Welcome to NCLEX over NCLEX. We are going to have a practice question about fundamentals of nursing. This video will help you think like a nurse, so stay tuned. Let's get started. The first question we have is: the registered nurse is preparing to insert a nasogastric tube in an adult client. To determine the accurate measurement of the length of the tube to be inserted, the nurse should take which action? A. Mark the tube at 10 inches, 25.5 centimeters. B. Mark the tube at 32 inches, 81 centimeters. Circa place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the xiphoid process. D. Place the tube at the tip of the nose and measure by extending the tube to the earlobe and then down to the top of the sternum. Answer: C. Rationale. Measuring the length of a nasogastric tube needed is done by placing the tube at the tip of the client's nose and extending the tube to the earlobe and then down to the xiphoid process. The average length for an adult is about 22 to 26 inches, 56 to 66 centimeters. The remaining options identify incorrect procedures for measuring the length of the tube. Question number 2. The nurse inspects the color of the drainage from a nasogastric tube on a postoperative client approximately 24 hours after gastric surgery. Which finding indicates the need to notify the healthcare provider, HCP? A. Dark red drainage. B. Dark brown drainage. C. Green tinged drainage. D. Light yellowish brown drainage. Answer: A. Rationale. For the first 12 hours after gastric surgery, the nasogastric tube drainage may be dark brown to dark red. Later, the drainage should change to a light yellowish brown color. The presence of bile may cause a green tinge. The HCP should be notified if dark red drainage, a sign of hemorrhage, is noted 24 hours postoperatively. Question number 3. A nurse is assessing a patient who has had diarrhea for 4 days. Which of the following findings should the nurse expect? Select all that apply. A. Bradycardia. B. Hypotension circa elevated temperature. D. Poor skin turgor. E. Peripheral edema. Answer: B, C, D. Rationale. Prolonged diarrhea leads to dehydration. Expect the client to have an elevated temperature, a decrease in blood pressure, poor skin turgor, tachycardia, and weakened peripheral pulses. Peripheral edema results from a fluid overload. Question number 4. While a nurse is performing a cleansing enema, the client reports abdominal cramping. Which of the following actions should the nurse take? A. Have the client hold their breath briefly and bear down. B. Clamp the enema tubing. C. Remind the client that cramping is common at this time. D. Raise the level of the enema fluid container. Answer: B. Rationale. Clamp the enema tubing for 30 seconds to reduce intestinal spasms. Telling the client that cramping is common is non-therapeutic and implies that the client must tolerate the discomfort and that the nurse cannot or will not do anything to ease it. Question number 5. A nurse is preparing to administer a cleansing enema to an adult client in preparation for a diagnostic procedure. Which of the following steps should the nurse take? Select all that apply. A. Warm the enema solution prior to installation. B. Position the client on the left side with the right leg flexed forward. C. Lubricate the rectal tube or nozzle. D. Slowly insert the rectal tube about 5 centimeters, 2 in. E. Hang the enema container 61 centimeters, 24 in, above the client's anus. Answer: A, B, C. Rationale. Warm enema solution because cold fluid can cause abdominal cramping, and hot fluid can damage the intestinal mucosa. Place the client on the left side with the right leg flexed forward to promote a downward flow of solution by gravity along the natural anatomical curve of the sigmoid colon. Lubricate the tubing to prevent trauma or irritation to the rectal mucosa. The correct length of insertion of an adult patient is 7.6 to 10.2 centimeters, 3 to 4 in. The maximum recommended height to hang enema container is 46 centimeters, 18 in. Question number 6. A nurse is teaching a client who reports stress urinary incontinence. Which of the following instructions should the nurse include? Select all that apply. A. Limit total daily fluid intake. B. Decrease or avoid caffeine. C. Take calcium supplements. D. Avoid drinking alcohol. E. Use the Creed maneuver. Answers are B, D. Rationale. Alcohol and caffeine is a bladder irritant and can worsen stress incontinence. Stress incontinence results from weak pelvic muscles and other structures. Limiting fluids will not resolve the problem. Question number 7. A client with an indwelling catheter reports a need to urinate. Which of the following actions should the nurse take? A. Check to see whether the catheter is patent. B. Reassure the client that it is not possible for them to urinate. C. Recatheterize the bladder with a larger gauge catheter. D. Collect a urine specimen for analysis. Answer. A. Rationale. A clogged or kinked catheter causes the bladder to fill and stimulates the need to urinate. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload.